Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of the show, bringing another really fascinating guest today involved in creating a better tomorrow for many people out there. Today on the show, we've been honored to be joined by Sarah Mastrorocco, who is the Vice President and General Manager of Health at Instacart, the retail delivery company and retail media company that operates a rather large grocery delivery and pickup service here in the United States and Canada, over 100,000 different grocery stores, working with thousands of consumer packaged goods brands. A really innovative leader. Sarah spearheaded the creation of Instacart Health and continues to oversee the initiative, which is designed to support consumers, businesses, and nonprofits across three major areas: increasing nutrition security, inspiring healthier food choices, and ultimately scaling various food and nutrition programs within healthcare. And in this current role, she's focused on expanding consumer health tools and empowering various organizations with technology to ultimately help improve access to nutrition, food, and education. Sarah's a longtime Instacart veteran, played an integral role of the company since joining. She was the first member of their business development team back in 2014 and has held various leadership positions across the organization. Prior to Instacart, Sarah held many roles in other CPG companies, including at PepsiCo in business innovation, M&A. She was involved in QA at Hershey's, doing some really cool testing of chocolate and peanut butter, and as well as the consulting segment. A lot of cool topics to get into today. Honored to have with us Sarah Mastrorocco. Thank you so much for taking time to come on the show.
Thank you. Fun to hear that my whole past come back at me there, and you did a nice job with Instacart Health. So thank you. It's great to be here, and I appreciate your time.
Yeah. I look forward to the discussion. I'd like to jump right into it. I'd love to just hear a little bit more about your background and what interested you in the food industry to begin with. I got to tell you, if I was offered a job early on in testing chocolate and peanut butter, I'd just be there for 50 years. But tell us a little more of the backgrounds here.
I love it. No, yeah, I like that we're going way back. I'm originally from the Hershey, Pennsylvania area, and my dad worked for Hershey his whole career. And so that was my summer job. My summer job was working in factories, testing, for safety testing, quality testing, chocolate and peanut butter. And that was a fun first summer job. And I think it definitely influenced, growing up with Hershey in my life, and like that being my first job influenced me in like loving food and loving snacks. And coming to the industry, I think, after college went into consulting, but then went to business school because I wanted to go back to consumer brands and industry, and I loved food. And that's thankfully how I ended up at Instacart. Worked at Pepsi after business school doing strategy and M&A and on their food side. And then had moved to San Francisco for personal reasons, and I wanted to try a startup, right? Wanted to get into technology, and found a small company called Instacart and said, wow, this is cool. This is like technology, but what I know about and what I'm passionate about, which is food. And it's been a wild ride since then, over 11 years, many hats. And I'm so thankful to be able to kind of bring my food hat and, consumer hat, but to a technology world, and have had so many cool opportunities to, of course, develop Instacart and build our retail partnerships. And then going back to my consulting days, I used my SQL hat and like running our catalog team, and then back to retail partnerships, and then ran pickup during COVID. And I get kind of the whole theme of me at Instacart has been like, of course, growing the business, and I love what we do. I love enabling retailers and helping people. And I think what I've always been passionate about is Instacart can be for everyone, and I think COVID helped change that too. really,
Hmm.
really reframing that Instacart is not just a convenience, right? It really can be a necessity. And we were a lifeline to so many people and still are today, but it really shone a light on like, can we deliver for people, like, quite literally, they can't leave their homes for
Right.
many reasons. And I think that helped really plant the seeds for Instacart Health
Hmm.
early. And EBT SNAP was our first, I would say, foray into access. So bringing EBT SNAP, supplemental nutrition assistance, federal assistance online, something that we pioneered working closely with the USDA on how do we bring it online? Because it was accepted in store, but it wasn't online. And today I'm proud that we were able to do that. We are in all 50 states in Washington, D.C. that you can pay with your SNAP card online,
Nice.
over 30,000 stores. And what we've heard from our EDP Snap customers is, you're solving for time and transportation, but you're also helping me budget and maybe shop from better stores you don't have access to. And there's some stigma and stress involved with using a financial assistance sometimes. It's anonymous online. And you don't have to, when you get to the register, you don't have to put things back. Like there's a stigma in stores like, oh my gosh, I went over my budget. I can't. I'm embarrassed, right? But online, it's like, oh, I take things in and out of my cart all the time. Oh, my running total's looking steep. So people really do use Instacart in very different ways depending on, what your goals are. And that was like that really planted the seed of like Instacart can be, like we can use this platform, and that's my job at Instacart Health to be like, but say Instacart is not a separate app, right? An initiative that we are using this powerful platform that reaches over 98% of households and over 95% of people in food deserts. Um, let's use it and let's try to find people that we can help more and directly via EBT Snap or accepting your Medicare supplemental benefit card. We're working really closely with nonprofits and health plans to design programs. And you mentioned that, Ira, in the beginning. It's give people access. Once they have access, they make informed choices. Those are our first two pillars. But combining those two is uh, is what we're doing with our business partners or organizations. So let's combine those two. Let's create formal programs. Molina Health Plan in Michigan is a great example. At risk, high risk pregnancy moms are getting $100 on Instacart for 9 months, 18 months of membership to spend on nutritious foods. How can we make sure they're healthy moms and babies? Do we keep babies out of the NICU, right? So I think that's great for everybody. We want healthy, and we also want lower cost of care, like lower health outcomes and healthy babies. So I rambled a bit there, but
No,
I
no, no.
gave you a longer answer.
It's really cool, and it's interesting. Along with your experience, it's a very interesting, well, entrepreneurship story with you in the sense that, hey, Instacart's put together hundreds of thousands of stores and all these retailers and so forth, and you came up, hey, I don't know what exactly happened. You can tell us if you want. You went to the CEO's office one day and said, you know what, we need to, as the mission says, we need to start delivering the ingredients for healthy living. Any just interesting side stories related to what it's like setting up a sort of a venture initiative like this in a major tech company like Instacart?
I think, yeah, taking a step back, that I have been very fortunate. I like entrepreneurship to be able to build things within Instacart, be entrepreneurial, but be part of a bigger company, like a much growing, larger company. And I think that speaks to Instacart as a culture is always about, of course we've done it this way, but maybe we should do it a different way, right? Or how do we think bigger? How do we think outside the box? And that's encouraged. And we really want to follow growth too, right? Like, and this isn't when I always say what Instacart Health is it is a business. My goal is to find people that we can help, but as part of that, they're going to come to Instacart, spend their money, and stay. Right? We really are creating um, new customers, new opportunities, new occasions, and new customers. So I think that's part of the reason that it works. But then when we created Instacart Health, that was also timed with our Fiji Simo, our outgoing CEO, came, and she's been very passionate about health. And I believe she was a huge sponsor of it and believer in the role that we can play in health and that food is so critical.
Mhm.
Um, you know, everybody eats at least 3 times a day. How can we play a role in? And we know that nutrition is critical for your health. 100 million Americans have diet-related chronic disease.
Yep.
We spend 1.1 trillion in healthcare related to that. So I think knowing that as a thesis of okay, and we also can get to almost everyone's home today. Instacart, what's our role? And so, Fuji was instrumental in sponsoring that and pushing us as a team to say, what is our role to play? And is it delivering ingredients for healthy living? It's a good catch line, but what is the meat of it too? And a year before we launched Instacart Health, we just called it access to food and nutrition because it was really important for us to health to be a real, a real thing, a real business. It's not a vanity plate, right? So access to food and nutrition was growing Snap, thinking about all the ways we should help people, and then launching Instacart Health. Actually, got lucky, but also timed it well with the White House Conference on Health, Hunger, and Nutrition, launched at the end of September 2022. There was really just a ton of momentum, and there continues to be, I think, bipartisan momentum around food, like food and health and nutrition. And so we are thankful to, have Instacart behind us. And I think we operate Instacart Health in a way that, again, just builds Instacart and builds Instacart's business. And definitely want to talk more about that, but I know we have a lot of time here on this podcast, but about, there are ways that we help businesses and especially health plans and health systems, but also just any consumer coming. We're really constantly innovating on how do you as a consumer come to Instacart and make informed choices that are personalized for you and your family.
Excellent. Yeah, let's drill down on some of these topics. You mentioned the SNAP program earlier, and I'd like to get into this broader topic of food deserts. We actually, the brother of the current head of HHS, Robert Kennedy, is named Chris Kennedy, and he came on the show a couple of years ago to talk about his work and getting nutritious food to people through his company. But obviously, what Instacart's doing, you have your tentacles potentially and ultimately taking this principle of food desert, which the USDA defines as the people that are low income and a certain distance from access to a supermarket of fresh food, and creating, in essence, what the opposite of that, a food oasis, where you can access all these potential beneficial foods. Reintroduce us to the theme of food deserts and this principle of how nutrition security can be enhanced via what you're doing in Instacart Health.
Yes, happy to. And I think, there are many terms. I think the one that is most common or most people associate with food desert is, is not living in an urban area. I believe it's like a mile, right, within a store. Rural might be 10. And there are food deserts both. I think when we think of food deserts, maybe in your head, you might think of a desolate area in a city, but there are plenty of Americans in very rural areas that also have a ton of access problems. And, when we think about Instacart, we think, how do we get you access to a store? But not any store. We want it, when we say 98% of households, we mean a full service conventional grocer, right? This is not a mini mart that we are saying that we can deliver to your home. And that was important to us too. But we know that getting access to nutritious food is like the number one thing. Like it's foundational to your health, right? Can you access it? And to your point, we saw that we had a role to play because we have 100,000 stores across 1,800 retailers on the platform. How do we both just make them accessible to people, but then also give them like financial assistance, right? Or make sure that they have access to all the money, what we call health wallet, right? If you come onto Instacart, you should be able to add any card that you have, right, and make it work. And that's not a standard. Payments are difficult integrations, right? When we integrated EBT SNAP, you can use your debit card. Again, if you're on a Medicare Advantage, you might want to use your supplemental benefits card. And then we created our own credit system, which we call Fresh Funds. And Fresh is meant to describe like the type of payment, not just for fresh foods, but it's a filtered spend. And we like all the filtered spend cards out there, but we created our own because we saw a need, and working with organizations that they wanted to fund really specific medically tailored groceries, which I think is a huge opportunity. You might have heard of medically tailored meals, related, very popular in healthcare for people who might be post-discharge, who can't cook for themselves, who are really diet sensitive, related disease, and likely have a food access problem. We believe medically tailored groceries is a huge complement to that. So let's say you release from the hospital for congestive heart failure, for example, like you have a very sensitive diet, things that you could eat could immediately put you back into the emergency room or readmittance. What's Instacart's role to play there? We could create a stipend, or we have people ordering on behalf of others, using the Instacart platform to get access to those members. And have seen a ton of momentum there, and I'm excited about that potential, really for a lot of reasons. Of course, because we're helping people and kind of teaching people to fish from the grocery store, but also because we're keeping funds local too. Supporting local economies with local stores is a big part of what we're doing too. And I think, taking it back to the food deserts, it's really, really hard to build a grocery store, right? It can take years. and investment, and we've seen this a lot in cities, and we love and encourage that. We want everyone to have a local grocery store. But a great example is Mayor Rickman in Columbia, South Carolina, came to us and said, we don't have grocery stores in this area. How can I kind of give access to residents of food deserts in Columbia, South Carolina? And they
Hmm.
subsidized just delivery, right? Let's say use your SNAP dollars, use your own dollars. I'm going to give you um, basically Instacart membership and $5 to pay for the fees, right? Like on Instacart. Been a popular program that we're renewing, but I love the kind of the quick thinking and ingenuity there. It's like, how do I eliminate food deserts virtually for
Hmm.
people? So we're really excited to work with Columbia, South Carolina, and continue to do work with them and removing, virtual barriers to food deserts.
Hmm. Hmm. And one of the things that is pointed out when we get into food as a topic is the fact that they're associated with various negative health outcomes, including very high rates of obesity and diabetes. And I thought this was, one of the, as you know, one of the groups that I profiled on the show several months ago was the Diabetes Research Institute, which you've partnered with
Mhm.
since then. And this sort of gets into sort of this whole principle as food as medicine. Would love to hear, because obviously diabetes an area when you put the direct and indirect costs together alone, just looking at, we're talking over $500 billion now, clearly major link to food. And some of the thing, and again, some of what they disclosed to me at the time was early in the day, sort of this principle of it being able to decide, hey, metabolically healthy foods for certain patients, be able to tailor specific diets, as you were saying. Could you, now that it's disclosed, can you take us a little into the world of your focus on food as medicine? But if you can talk a little bit about DRI or any other collaborations on this front, this is a very interesting topic to our show
Yeah,
and me personally.
absolutely. And you're right. I think even for me, several years ago when we were starting Instacart Health, I think my eyes were opened to like diabetes, right? Like, and how prevalent it is and how most Americans are pre-diabetic or diabetic, right? Or at risk. And I think that, DRI has done a great job. We also work with the American Diabetes Association, and our goal with those, any kind of organization, but especially in diabetes, because it's such a diet-related disease, is to support research if they're doing it, right? Like we can be a vessel for research, which we do a ton of research today, or support research on, let's say we want to do a study, and like we'll help kind of be the way that you get the food and how does that track outcomes, and et cetera.
Mhm.
And then also uh, we want to make informed choices. Like, how do we make the advice actionable, right? There's a lot of great content out there on recipes and what to eat. Imagine if you just click the button and now it adds to your cart, right? So that's we for a more popular example, or say like a more widespread example is New York Times cooking. That's not diabetes related, but show you technology that any New York Times. I have the New York Times cooking app. Cooked something yesterday on it, clicked the recipe, it was in my cart, right? How do we make that easy for everyone to follow advice instead
Mhm.
of you go to the doctor and the doctor gives you advice, or sometimes if they do, are equipped to give nutrition advice, is it a pamphlet that goes on in your car and you forget it, or is it in one ear and out the other? We really need to make it easy for people, right?
Mhm.
So I think organizations like DRI, like ADA, can really make advice actionable for people. And then, also again, partner on research to make sure that we can develop, food formularies or clinical
Yep.
outcomes, right, that really are showing. Um, and then back to, I think, taking a broader look, not just there, but we work with a lot of providers in the nutrition coaching space
Okay.
uh, for people that have diabetes. Great example. We work with Food Smart, which is a medical nutrition therapy telehealth company. They work with thousands of people, just coaching, telehealth. It could be phone, video coaching. And they early on have been an adopter of adding food or food care using Instacart as part of that therapy. And last November, we partnered with them and they released a white paper looking across 18,000 members that they had provided. So a huge study, really, when you think about what they've done over the last couple of years. 18,000 people, some have gotten just the medical nutrition therapy on FoodSmart, and some got it with Instacart Fresh Funds, like actually getting food as an incentive or part of
Hmm.
therapy. So I love that because, of course, nutrition therapy, dietitians are powerful and will really work, but how much more powerful can it be if we couple it with food? Because food is
Right.
engaging. Food can, like, how do we give people a stipend when they complete, when they complete a survey, or I mean, they complete a therapy session. So part of that, great results. So 53% of people with diabetes who combined telenutrition with fresh funds saw a clinically significant reduction in A1C, compared to 43% that only got the therapy, right? So it's a 53 to 43% difference in A1C reduction. Um, really, really powerful engagement, 50% higher engagement when food was coupled with therapy. Because sometimes it is hard to get people to make that change. It's hard, right?
Yeah.
So I think we're really excited about that. Like we also saw sustained a 5% sustained weight loss higher than it was when coupled food with the therapy. So I think again, kind of just going full circle on like your focus on diabetes. I love that. Like, love your interest in it. I think everybody kind of takes everybody to be at the table on like, how do we help solve this problem? Is it foundations? It's providers. What is Instacart's role? That's really how we come to the table with all of our partners. We
Mhm.
started as a retail enablement company, which was my first job at Instacart. Hey, how can we help you? We have a
Right.
marketplace. We can bring you online. We've approached that in healthcare too. It's like we have this big, massive, consumer product, this big device that can deliver to everybody and engage consumers. How can we help you? And I really think it's providing our fresh fund stipends as a tool, right, that they can fund. You can fund very specific groceries. It's providing informed choice. It's getting the word out with DRI, with they have a storefront page that gives people actionable advice, and the American Diabetes Association now as well. Just providing advice on what's to eat, cart starters, if you will, because I think small changes, when adopted, can really plant a seed and go a long way.
Mm-hmm. Yeah, well, and one of the things that you mentioned it briefly, I just wanted to emphasize it
Yeah.
because one of the things on the website it talks about supporting policy solutions for so-called food prescription programs, and there's actually something called the food pharmacy down the street here at the Children's Hospital here in Philadelphia, where you actually can get a prescription. Here, you go get eggplant or whatever. But are you seeing much traction on? I mean, in terms of sort of the clinicians and specifically those food prescriptions, because I know that's kind of a new thing, but that's just I wanted to emphasize that because I guess a lot of people are unaware that something like that even exists in the healthcare system, but it does, and I'm just interested in what you're seeing specifically on that front. I just wanted
Um,
to highlight that term right there.
no, totally, it's a great question. I think, yeah, food pharmacy are popular. I think they're hard to operate, but CHOP is obviously an amazing hospital and does a great job. We saw that and said, oh, could we do virtual food
Yeah.
pharmacies, right? Or produce prescriptions that can be fulfilled kind of anywhere or on the Instacart platform. And um, a lot of it has been privately funded, right? A lot of that comes from like a foundation money. What we are excited about and we talk to policymakers about is the ROI on food, nutrition care. There have been a lot of waivers for Medicaid waivers called 1115 waivers or in lieu of services um, that are offering food uh, or a stipend for food as part of healthcare. Like it literally can be billed as a healthcare claim. We just last month announced that we are now an atypical provider in the state of Michigan as part of their in lieu of services. Really excited about that. That truly was, part of our dream when we first started Instacart Health is can you actually provide food as a healthcare benefit, right? As a service of healthcare. So Instacart Health Services, the subsidiary that we have, is an atypical provider in Michigan. We can basically you can have your doctor, if a plan covers it, you can have your doctor prior authorize you. Let's say you live in certain regions and you have a pre-existing condition and you have a need, a nutrition security need. Your doctor can apply for you to get prior auth for a produce prescription. And then Instacart Health Services receives your name and reaches out to you and say, hey, great. Hey, now you have this produce prescription. Let us send you this fresh fund stipend. You can then choose the produce that you want. It might be a 3-month program. It might be, it could be a several month program or recurring funds that you have to use or lose or spend at your local grocer of choice. And then
Mm-hmm.
that at once Instacart, there's no money from the recipient or the health plan member. We would bill that like just like a healthcare claim. So really excited about that. I think those are all, in lieu of services is a waiver that, we're trying that. And I'm excited to see how powerful results we can be because I would love that to be commonplace. Not because it's great for Instacart, because it's great for health, right? I think if
Yeah.
we're really talking about that $1.1 trillion of healthcare, right, that it comes from diet-related chronic disease, can we together flip the switch and get people to like produce, but taking a risk is hard, especially if you're on a limited budget. I think that's another thing, going back to food deserts and nutrition security. You buying a shelf-stable product doesn't go bad. There's no risk there.
Right.
But with produce, there's a ton of risk. Or it's
Yeah.
getting my kid to try something they don't like. I don't have extra budget, right? Like, I might not have an extra budget to be like, hey, try this, like you name it, try this celery. No. It's like, oh, well,
Mhm.
that's several dollars of my budget that I can't risk. So I think there's a lot of power in produce prescriptions and medically tailored not groceries, not just to give people the extra money or like solve for nutrition security, but to change healthy habits. It's really about like kind of shifting mindsets and habits that, that money spent today can pay off years from now.
Excellent. Excellent. We talked a bit about sort of the chronic degenerative diseases. Let's go to the other end of life here because you have another really cool program. This was in collaboration with Northwell, Melina Northwell, I believe, called the Northwell Center for Maternal Health, Maternal Outcomes, and Morbidity Collaborative, MOMS.
Mhm.
And a lot of people don't know. We've done a couple shows on this topic as well that we got a problem in the United States with maternal mortality rate compared to many other countries. And I found it quite interesting that you've now connected that issue, a very important one, with food insecurity. Talk a little bit about this and specifically, again, accessing the theme of access, of course, for specific communities, whether they're food deserts, whether
Mhm.
they're the Black and Brown communities that have these disparities. This is very important because we don't, again, we think about prenatal care and this and that, but food,
Mhm.
proper fresh food when you're pregnant for 9 months, very
Yeah.
important. Um, please.
So helpful. I'm glad you brought that up because I agree. Like diet-related chronic disease is like the call to action, but we've honestly learned so much from our partners like Northwell, which is the largest, New York's largest health system, has been a partner of ours. And then Molina, you mentioned too, Molina of Michigan is a Medicaid managed care organization that also, when we speak to partners, are like, how do we help maternal health? And I think to your point, it's a hugely sensitive time, right? And like a really important time for like generations, right? To like treat mom and baby as best we can to prevent preterm babies, have healthy moms too, right? How do we take care of mom, not just in the 9 months, but that fourth trimester, I believe is just as important. I'm a mom of two, and like that's just as stressful, if not more stressful. How do I take care of myself and this baby, right?
Yeah.
And feed myself while I'm trying to take care of this baby. So um, we've seen a lot of interest there because, to your point, of the maternal health crisis, right? And also just like how fast of the results you can see, right? Like they
Right.
really do need to help this mom in this critical time. And we can see that we are helping, right? That the babies, maybe we prevent preterm births or we, prevent complications, and we have healthy moms that feel less stressed. It's already stressful enough to have a baby. Um, Now I have to figure out, like how can I eat for two, right? Or like make sure I'm treating myself well. So yeah, Northwell recognized that, and we worked on a fresh funds program with them. Same with Molina Healthcare of Michigan. It's a monthly stipend for moms who screen nutrition insecure and have high risk pregnancies, and we want to make it as easy as possible, especially moms who might have mobility trouble during that time as well. So it's like, here's your stipend. Yeah, it all works as that health system or plan might hand the stipend to the mom. It's very easy to click on and go to a page on Instacart and say, yes, I'd like to redeem this stipend. By redeeming it, I'm going to share what I bought or my usage back with the plan too, because that's really important too. How do we tie health outcomes to like what actually happened?
Right.
And it's all consumer led, and they're coming to Instacart as a customer, but identifying themselves as wanting to be part of this plan using the code, spending on what they want, and then we report that back to our health partner. Let's say if I'm in the program, Sarah's opted in, she spent $96 over her $100 last month, and here is exactly what she bought with that money.
Hmm. Hmm.
So I think really important on just on the engagement side. Did Sarah engage, right? Did I engage? How did that relate to my health outcomes? What did she buy? Like, how did that relate? So I think there's so much data that is powerful that can help not just Sarah, right? But how do I need to stop talking about myself in the first person? Like not just Sarah, but can help moms in general. How do we learn and get better programs and be more effective and efficient? I think that truly is something that's resonated as well with our health plans, that it's not just, here's a gift card, see ya. Like I hope it works, right? It's like,
Right.
no, really, like I'm just paying for, like, Sarah, if she chooses to engage in the program, I get to see what she's bought and I get to tie that to like how she's how healthy she is. Instacart doesn't know the health records, but we pass on the purchase history so that our health plan partners can use that to learn and grow and support the specific mom, but also the whole population of moms. To your point, like going back to our crisis, we think food can be a real help and solution in
Hmm.
that area. So I only see maternal health programs growing,
Yeah.
and
Yeah.
a really an immediate opportunity when we talk to health plans.
No, it's no. Again, it's exciting seeing all these different opportunities come together and the types of partnerships you're putting together. Obviously, very successful with government, with these various healthcare and hospital systems. Can you say a couple words about your collaboration with the Meharry Medical College and specifically something on the Journal for Healthcare for the Poor and Underserved? Because here again, maybe we think these topics may not be as popular or dispersed yet within academia, but food access, nutrition security, health outcomes related to it. Say how you're working here with academia, because I think this is a very important piece of the puzzle as well.
Absolutely. We know the importance of establishing evidence in nutrition programs, and that it's critical in healthcare, period, right? Like, what is the evidence? And so we're committed to advancing research, and that's partnering on live research, but also working to highlight all the work that has been done too, to addressing food access and security. So we collaborated with Meharry Medical College. That's one of the nation's foremost historically Black medical colleges to
Yep.
publish a special issue it's called Journal for Healthcare for the Poor and Underserved,
Okay.
and it includes new research. So we asked, with them, they sought for people to apply and publish their research, to examine food access, nutrition security, health outcomes, shining a light on, we've already talked about, unique barriers facing marginalized communities, including Black and Hispanic households, urban and rural, and just families living with low income. So really excited about that. It's, available today, just highlighting, hey, there's a bunch of research being done. Let's put it all together and say, like, there's opportunity here. Food access can really move barriers. Um, and we continue to work with universities, the American Heart Association, American Diabetes Association, like DRI, right? If anybody wants, we work with a lot of universities that say, hey, I'm doing this study and I want to give this food for this amount of, like, people. So that's like, I would say the Mhari one is publishing research and really shining a light on what has been done. And then the other side is we get approached all the time on, I'd like to design a study, right? And I'm like,
Right.
um, and we're like, great. Fresh funds can be like a vessel for your study, right? We can be the backbone of the study. And we work a lot with, how do we engage consumers using the platform? How do we design a fresh funds program similar to, we work with, very early on, we partnered with Kaiser Permanente on a large study
Okay.
for diet-related chronic disease. That's still going on now. $100 a month for 6 months, only on metabolically healthy foods, right? And it's for people that, they've identified in their Medicaid plans at risk with diet-related chronic disease and a risk of food insecurity. And the study was designed to give them the $100, but let them spend it as they see fit. So we're
Mhm.
excited about that, really giving people agency, but within reason. The fresh funds credits or stipend they receive only works for, and they chose the diet, and it was, fresh and frozen produce, nuts, seeds, legumes, healthy oils and spices. Like, how do we really encourage people to buy things that they might not normally buy for themselves?
Mhm.
Um, so lots of great research out there. Unfortunately, it's not instant, right? I'm
Right.
the consumer tech world. We like to test things immediately, next day with tech, but in healthcare, it takes time. But I'm constantly like energized about the forward momentum
Mhm.
that we're seeing both in these long, like long studies and research, and then in our just our live programs that we're able to publish. I talked about Food Smart, that released those studies. We also worked with, I guess, because one more or quick results that we were proud of is with Wellness West. Wellness West is a conglomerate of, like a lot of federally qualified housing centers in the west side of Chicago, and they wanted
Okay.
to do a program, as well, helping address food insecurity on Chicago's west side. And it was a year-long program, so it's similar. It's like when we think about programs, it's not like a here's your $100 of food, see ya, right? Like, how do we
Right.
really, we bring people along, and they worked with, community health workers, engaging people, giving them, they gave a $79 stipend monthly to work on groceries, really. And after the first year, nearly 60% of patients with hypertension improved their blood pressure, and 50% of people with diabetes improved their A1Cs. So just great. We're renewing that program, entering more people, but I think the theme here and with Food Smart is um, really accompanying, food can be a really strong accompaniment to engage people and drive behavior and change behavior. And it happens over time. And it doesn't have to be feed people hundreds of dollars. It can be a supplement to get people started. And
Right.
what the value there is, you also can come to Instacart and use your own debit or credit. You can enter Snap cards. So you can combine all the wallets within one order and complete the weekly shop. And that was important to me too. And I think it's important to Instacart that it's not just here's your credit, you can just do this, or here's your food box. Like you really can teach people, let people order from their grocery store that they want and spend all their funds at one time to make it convenient for people because saving time um, and especially removing transportation barriers is, as social drivers of health. Those are huge
Hmm.
opportunities that we can overcome.
Yeah.
I
No,
want
it's
to I want to
exciting.
talk about consumer too because we haven't talked about that, and
Please.
that's my fault. But we we it's important for Instacart. Like I always talk about because I'm talking every day to our business partners. But anybody that goes on to Instacart, we want you to be able to like make informed choice, and we've done a lot, even in the last few months, but continue to do more with um, making it making kind of the store more personalized to you based on your specific needs, right?
Yeah.
Because not what might be healthy to you might not be healthy to me, or what preferences, or like diets, allergies, like dietary
Yeah.
restrictions. So we really um we are rolling out, and we have rolled out health tags, and we are rolling out health preferences basically.
Right.
So health tags are you know 30 AI-driven tags covering roughly 500,000 different products. So when you go search on Instacart, you might want to search for cereal and then filter on gluten-free, right? Like
Hmm.
you could search on soup and make sure it's low sodium, right?
Right.
How do we help people find things very quickly, which is hard to do in a physical grocery store, right? Like
Yeah.
how do we help people complete that shop? But we wanted to take that a step further too, and we have a preference center that you can go on, and there's 16 different related preferences that you can set in your profile too. Let's say I want low sodium. And so we're not going to restrict the store. We're not going to like shrink everything so you can't find it, but we're going to help merchandise things that we know that are more important to you also.
Got it.
Um, so those are steps that we are taking to make sure that we understand our customers' needs and start to develop and design stores around them. And
Hmm.
beyond, of course, we want to show all the nutrition facts and make that and ingredients and show for people. I would also add, the tags also include ingredients and additives and things. It's so important for people to know what's in their food, right? And what's not in their food.
Oh, yeah.
So we continue to really, really invest there. That's an ongoing journey for everyone. How do we continue to make sure that we provide consumers what they want, but like make it in an accessible way? Of course, we're using generative AI to do a lot of that. It's making it easier, right, to
Yep.
figure out what's in your food, maintain it, um, and listen to our customers. And I think that's what makes us the powerful B2B platform, is that we're not just like, hey, let us serve you business. It's like at the end of the day, it's always about the consumer and
Right.
can we engage this customer and keep them happy, right? And like really keep them coming back to Instacart because we're helping them make healthy choices easier. It's more convenient, right? And oftentimes it's saving them money because they can stick to a budget, right? And shop from
Yeah.
stores that they want to shop from.
Yeah, it's nice seeing all this, unfold. I mean, I think about sort of where nutrigenomics, say, like what we're talking about now, was, 20 years ago, and seeing you now able to merge it with this technology, with the AI, and ultimately, yeah, it's all about personalization, and what's good for you might not be good for me, and so forth. But yeah, it's exciting to see this all come together, and I applaud you for
Thanks.
putting this all together in this way so quickly. What else, Sarah, is coming up that we should know about? I know we're coming up against to hard stop. But in terms of other public facing initiatives, I mean, it seems like every day I see a new press release about some deal that you did per the organization and relationships. But what else should we know about while we have you today as we get into the later part of 2025? Any other initiatives, other conferences that you're going to be at? Anything else you want to mention while we have you?
No, great question. I think we kind of coupling off our talks on Medicaid managed care, we continue to see momentum there. We're trying to engage with all across states and health plans and like how can we help you with maternal health, right? With diet-related chronic disease, with children and nutrition security. So I continue to see momentum there, and I think you'll see more from us coming. And then the other thing is that we didn't talk about, but really important on the informed choice side is we announced a partnership with FDA, and that we in the coming months we're going to make it even easier for consumers to discover and shop for foods that align with FDA's latest healthy criteria. And that relates to all the health tags that we just talked about. But we want to make sure that we can be an amplification tool there again for the government and the FDA to make healthy choices. So I would say, on the consumer side, we're continuing to roll things out, excited, and on the healthcare side, really across healthcare, we're open, but we see the most opportunities within Medicaid managed care organizations, helping really drive engagement and improve health outcomes.
Awesome. Final question while we have you today. I'm gonna squeeze this in with 30 seconds, but I'm gonna go first lurker now. I'm gonna go back to Hershey's, Pennsylvania, and I want you to tell me in the 30 seconds we have in that 1980s commercial where the guy and the girl come together and he's holding a chocolate bar and she has an open tub of peanut butter on the city street, why she's walking around with an open tub of peanut butter on the city street, and go.
I'm gonna go with it's high protein. Just kidding, but peanut butter is a good snack. But you reminded me to watch that commercial again, honestly, because I got a heads up on this one. And I was born in 1981, and this commercial is from 1981, so I can't take credit for it. But I did love it. It was fun to see again, and it's funny how maybe advertising has changed and not changed in the last, 43 years.
Well, it's really great having you. I really enjoyed again, hearing your story of entrepreneurship, of really expanding this technology platform to something, totally different. And just, I'm going to continue to follow you and the organization and see where this all leads, because it is a very important set of topics near and dear to me personally, but to our show. Again, for everybody that's going to be listening to this episode across the various podcast networks, or who'll be watching on the YouTube channel. Again, you've been spending time with Sarah Mastrorocco, Vice President and General Manager of Health at Instacart. Sarah, I want to thank you for taking the time out of your schedule to come talk to us for a little while. Thank you for everything you're doing there to create this amazing system. And as we like to say on our show, thanks for helping to create a better tomorrow for everybody out there via what you do. Really an awesome story.
Thank you so much. I appreciate your voice and like what you do, and like everyone who you're amplifying, and just the time today. And my last plug would be, you should put link that ad to the 1980s peanut butter ad so people see it when you post it. But also maybe link instacart.com/health.
We'll do that. All right, be well. Great having you.
Thank you. Take care.